All right, Doc. People have been cooped up for a while here, and talk to me about what people are going through at this point in terms of not being able to go out. Or, is cabin fever setting in? Are they going to get antsy? What's going on?
People are getting antsy. Cabin fever is setting in. I can't believe it was over a month that we had our last conversation, and my hair's gotten longer, and this is very difficult. A lot of people are becoming increasingly anxious. I've been getting calls from friends and former patients who are having anxiety attacks, and it's about being out of control. Particularly people who like to be in control are feeling out of control, and they are out of control. That's the reality. And this is an opportunity to struggle with that old serenity prayer about, accepting what you can't change. Right now, we have to continue to stay in. We're lucky that we can at least go outside, get some fresh air, get exercise. I think one of the ways of trying to cope with this situation is appreciating whatever you can appreciate about our situation and your life. Right now, we're lucky to be here. I'm originally from New York. I'd much rather be stuck in my house in Key West and be able to go outside and smell the flowers than stuck in New York apartment and where it's really pretty gloomy and scary. So appreciation of what we're got here, the fact that there's been a relative small incidence of people being sick down here, 3 deaths in Monroe County so far. We're pretty lucky. Also, there's some good things coming out of this. People are spending more time with their families. Parents are spending more time with their kids. People who are overworked and harried all the time are being able to struggle with slowing down, settling in, and smelling the roses, as they say. This is an opportunity to practice appreciation of relationships, the relationships we're in, the relationships we have with people who are distant, staying in touch with them. But again, I want to emphasize this is not easy. This is really abnormal. And if you're having a rough time, that's okay. That's normal. Speak to people about it. Reach out. I'm sorry.
Go ahead, no, I'm sorry.
Well, reach out. I mean, I'm concerned about suicide increasing. Statistically, that is on the rise. And as I said the other week and other month, and as I always tell people, suicide is not the answer. It's a permanent solution to a short-term problem. And as long as this is going on, it's still a short-term problem. This too shall end, and we will get back to reality and real life. And it might be quite different. We'll be probably wearing masks for quite a while. This is not going to go away. There is no vaccine or treatment going to be available in the near future, probably at least 6 months. People who are older, which supposedly I am, so people tell me, or people who have underlying illnesses, are going to have a really rough time with this disease. It is not just like the flu. People have been very cavalier about, oh, it's just the flu, I'll get over it. Younger people are dying from this. It is a really nasty disease and should not be ignored. So pay attention, practice all of the safety precautions, wear a mask. I have a mask. I'm just not wearing it right now because I'm 6 feet away from Tim here. And wear a mask, wash your hands. It's interesting that the bathrooms in restaurants say employees must wash their hands. They say that because people don't, which is a disturbing thought. People are told to do things in signs and legal signs like that because they usually don't do it. You must wash your hands.
Talk to me about some of the typical symptoms of someone is experiencing anxiety, and what are they feeling? What's going on, and what can they do about it?
People are having physical symptoms. Anxiety is a physical experience. You feel shortness of breath. You feel a pressure on your chest. You can feel stomach cramps are a symptom of anxiety attacks. Sweating, increased pulse rate. It's all brilliantly designed because an anxiety attack is really a fight-flight response without the actual physical attacker. Fight-flight responses are brilliantly designed. Our bodies are designed to prepare us to run away or fight a threat. It increases our heart rate to send more blood to the big muscles to run away or fight. It increases our breathing, so we have more oxygen for our muscles to run away or fight. It actually shuts off blood flow to the stomach as a way of sending more blood to the big muscles. In fact, it even tightens the capillaries in your skin so that if you're cut, you don't bleed so much. And it creates a tunnel vision so that you see that saber-toothed tiger that's coming at you. It's brilliant for when there's a saber-toothed tiger coming at you. It doesn't work when your thoughts are generating this anxiety attack. Thoughts like, I'm going to starve to death. What will I do about my career? What will I do about my family? What will I do about anything? What can I do to make this go away? All of these thoughts are going to interfere with your being able to relax because they're intrinsically anxiety-producing thoughts. So watch what you're thinking.
Isn't there some kind of breathing exercise or something? If you're feeling shortness of breath in terms of anxiety, that's common. And not only that, shortness of breath is a common symptom of COVID. So I can see people starting to think, oh my God, I'm infected, and then it compounds itself. So tell me something about it. Is there a breathing exercise?
Yes, that's a great question. First of all, diaphragmatic yoga-style breathing is the gold standard for treating anxiety. When people have anxiety attacks or panic attacks, where they're having an anxiety attack and then having the thought that because my chest feels tight and my heart's racing, I must be having a heart attack, and then they get in a loop that I must be having a heart attack, which increases their anxiety, they wind up in the ER, and they're usually given Xanax or Valium, and the best treatment for that is diaphragmatic yoga-style breathing. If you learn how to do that, and understand the panic attack is a panic attack and not a heart attack, you will stop having panic attacks. It takes some training, but it's quite effective. In addition, from what I understand, the COVID attacks your lungs. And current research is showing that rotating people's position when they're in bed and having them do deep breathing is actually a treatment for the disease. Learning how to do deep diaphragmatic breathing can actually help you survive a severe COVID attack, from what I've heard. I don't want to be recommending treatments like our president does, but I know it certainly helps for panic attacks. And it can't hurt you to learn how to breathe deeply.
Yeah. But isn't there like a breathe in for 8 seconds, hold it for 8 seconds,
yes,
breathe out kind of a thing?
Exactly.
Can you explain that?
Well, you want to breathe slowly. You want to do a diaphragmatic breath. So you're not just doing a traditional upper chest inhalation. The way to do it properly is you start with your hand on your belly, and I have a big belly for demonstration purposes. It shows how dedicated I am. You first breathe into your belly, and you can see your hand rise. And then bring the breath up to your chest. And do that for an inhalation of 5 if you can, 8 if possible. So it's like this. Hold your inhalation for about a second. Take little sips of air. And then exhale slowly for the count of 8. 5, 4, 3, 2, 1. And at the bottom of the exhalation, suck your stomach to your spine. That squeezes out the older air that's in your body, and then begin the process. You're not breathing into your belly. There's no lungs down there, but what you're doing is you're pushing your diaphragm away, which pushes the belly out, which allows the lower lobes of the lungs to fill. because when you do a traditional chest out deep breath like that, you're only filling half of your lungs. So when you do a diaphragmatic breath and push your diaphragm away and your belly goes out, you're allowing your lower lobes to fill with air, and that doubles the amount of oxygen you're intaking. If you do this and you're watching and you feel a little lightheaded, a little dizzy, that's good. That means you're doing it right. That lightheadedness is oxygen, and if you're feeling lightheaded after 4 or 5 breaths, it just shows that you have a very low tolerance for oxygen. It's like somebody who doesn't drink having 1 drink and feeling lightheaded. It's the same thing with oxygen. You have a low tolerance for oxygen and you want to increase that. So the best thing to do is practice breathing. You go on YouTube to, I'm sure there are stations for diaphragmatic yoga breathing. Follow them. But it's important that the breath should be an inhalation for a count of 5, if not 8. Hold it for at least a second, and then exhale really slowly for a count of 8. And while you're doing that and focusing on your breath, you can't think about the end of the world. You can't think about starving to death because you're focusing on your breathing, and that's why it's a form of meditation as well.
Talk to me about coping mechanisms. And, it's easy to, like I said, I think we've covered this last time, to catastrophize. What am I going to do? What if the world ends? What if I never get another job? Can you talk a little bit about corralling your thoughts?
Well, corralling your thoughts exactly is the way to put it. Remember, these are just thoughts. And when you're anxious and you're dealing with an unknown situation and you're not in control, your thoughts are going to be more self-destructive, more traumatic, more catastrophic. But remember, they're thoughts. There's a distinction between thoughts and feelings. Our feelings are we're angry, we're thirsty, our feelings are more in our body. But people mislabel thoughts as feelings. So they'll say, I feel like I'm a failure. I feel like I'll never get another job. I feel like I'm too fat. I feel like I'm stupid. All of those thoughts are mislabeled as feelings. And you're never wrong with your feelings. If you're angry, you're angry. If you're sad, you're sad. But you might be wrong about what you think, and especially these kind of thoughts. So be aware of that distinction. And if you be aware of what you're thinking, it's really important. This is an opportunity for people to really grow emotionally. In therapy we talk about goddamn growth opportunities. Well, this can be one of those. So take advantage of it. Appreciate your friends. Appreciate where we are. Learn to breathe. Learn to meditate. Try the Yoga Nidra meditation. Go to YouTube, put in Yoga Nidra, and there are many guided meditations. It's meditation for people who can't meditate because it's guided and it's relatively easy and it works. It really calms the body down.
So to wrap this up, let's talk about I don't know. Let's talk about coming through this. That there's going to be another side. Can you give me some kind of perspective here and help people out with the fact that we're going to come through this, and like you said, not everything's bad about it.
Well, not everything's bad about it. I could tell people that, and people might want to hit me because it's like, in their mind it's really bad. So what's this positive bullshit stuff? However, it's the truth. You can make it into a positive experience within reason. If you don't have a job and you don't have money for food, that's pretty scary. But there are people out there providing food for people who have no food. So you have to, if you're too proud to ask for help, get over that and ask for help. You should not be starving. Certainly not in this community. And there will be a vaccine. There will be a treatment for the disease. It might take a while. We might become like Asian countries where everybody's walking around with a mask. That's not so bad. A friend of mine, my internist, has told me that his usual flu patients have disappeared. Normally they're very busy with the flu this season. He's not getting any flu patients coming in because everybody's socially distancing and wearing a mask and washing their hands. So maybe people will get a little cleaner, a little healthier, a little bit more aware of health issues. And that would be a good thing. You got to stretch a little bit to make everything positive in this situation. I don't like it. I don't like worrying about getting sick. I don't like worrying about my wife getting sick. My friends, because all my friends are older, most of them, and it's concerning. But I just choose not to dwell on these things. You can control what you think about.
Well, it does. Don't thoughts drive? You said there was a difference between thoughts and feelings.
Yes.
Don't thoughts drive feelings?
Exactly. Thoughts drive feelings. If I keep thinking about, getting sick and suffering, or my wife's getting sick and dying, or, this thing never ending, or, not having enough food, I'm going to get really anxious. I'll get depressed. I'll get scared. It's those thoughts that drive emotions. Thank you for pointing that out. Thoughts drive emotions. So be careful if you're feeling anxious, if you're feeling scared, if whatever you're feeling, if it's unpleasant, step back and
break the thought pattern.
Well, just what was I just thinking about? Check out what was I thinking about. Identify it, and then break it. But first, become more self-aware. I'm freaking out. Oh, I was just thinking about grandma dying. Oh, maybe that's why I'm freaking out, because I was thinking about that. Become aware of what you're thinking.
Okay, just to wrap it up, how about just give me a couple of quick pointers on just mental health? Get out for a walk. Is there you got 4 or 5 things? What would you tell somebody?
Exercise. Go out for a walk. Eat healthy. Find something that you've wanted to do, that you've been putting off doing. Do it now. Spend time with your family. Spend time with your kids. Too many parents spend all their time working and not enough time with their kids. And the irony is, they say they're doing it to provide for their kids. And when I speak to the kids, they tell me they just want to be with their parents. So take advantage of this opportunity. Spend some time with your kids.